And I work specifically in the Disaster Information Management Research Center. And our job is to connect you to the best disaster health information in the most timely and most usable fashion that we can. And while much of our work is about gathering, organizing, and making information accessible, we also have an R&D component where we are doing some work and using virtual reality for training and using the wireless radio system for communication when the internet is not available. So some things a little out of the ordinary for a library. But why are libraries even involved at all in disaster preparedness and response? And we are not a response organization, of course, but we do an information response. And librarians actually have a lot to offer. And by now, you of course know that disaster preparedness and response and recovery is a lot about information that can be before, during, and after events. And who's better than professional information finders and organizers, who are by nature, are service oriented in their communities, and they have access in many cases to lots of technology in their facilities. So it's really actually a very natural fit. And in the US, while we have always thought that libraries are always known librarians and librarians can handle this kind of work, it took a little while for others. But back in 2010, the federal government recognized it and modified the act, which authorizes emergency federal funds to go to areas affected by disasters. And they, at this point, included libraries in what they consider to be essential community services, which can get funding to open up temporary facilities if affected during a disaster. So at our center here, we focus almost exclusively on providing resources to those of a professional capacity, as opposed to the general public. We don't ignore this sector. I'll talk a little bit about that later, but anybody who's just an example, emergency managers, public health officers, planners, veterinarians, social workers, psychologists and volunteers, veterinarians, all those kinds of professional roles that work in supporting a disaster preparedness or response effort. And we cover quite a range of topics we related to preparedness and response. And as you can see on this slide, we make sure we cover the normal ones you'd expect: natural disasters and CBRN activities, all hazard topics, and we'll cover more of this in a little more detail in a bit. Infectious diseases, and we try to focus on the definition of disaster that defines disaster as events that threaten or take away the ability of the local capacity to respond. So for us, disaster health information is divided into two segments, and the top part of this pyramid is the smaller portion, and this is journal literature, which is indexed pretty well in databases such as PubMed. The larger segment at the bottom is what we call gray literature, and we call this everything that's not in PubMed, but is critically important in this particular field. It's not published in commercial journals because it comes out of government organizations and many other types of agencies and organizations and other countries, everything. In this field, you can't always wait for something to be researched, written, accepted for publication, published, and then indexed in PubMed to get at it. The bottom part of the pyramid comes out much quicker, and that's the part we in our center focus on. And yet this information we call gray literature is just as authoritative as journal literature in this field. Along with those journal articles, gray lit is part of systematic reviews that lead to the development of evidence-based practice guidelines. So we are very particular about what we put in when we start looking at credible and information for the disaster workforce. So in a world of, I guess you could say, alternative facts and fake news, we must be especially vigilant. But you can see on this list, the foremost is that it comes from an authoritative and credible source and should be pretty current, and no advertisements, no point of view, and the audience has to be appropriate. And our point, it should be related to those who work in or support the disaster workforce, and a few other criteria as well. So we are pretty particular about what we put out there for our users. Now, the information toolkit, which is what we're going to talk about, and these are all the different resources that we have and how you can access them and how you can use them in support of your work. And we'll go through some of the bigger ones that we have available. So this is our homepage for the Disaster Information Management Research Center. We also refer to ourselves as NLM Disaster Health. And I want to point out, though, before I show this image a lot in the next few slides, but we're completely renovating our site. We're modernizing it and changing everything around. So sometime within the year, this will look completely different, and hope it will be more user-friendly and a little more contemporary looking. But regardless, you can still find whatever tools you need on our homepage, and I put the web link above there. And this is freely, everything I'm going to be pointing to is freely available anywhere in the world. So we don't put any limitations on that. So the first area, I'm just going to give you a real quick tour of the website on where you can find some of the things I'm talking about today. In the upper left side of the homepage, you can hover on these different links, or you can click on them and you will see what information you can find behind here. So here we have disaster topics and different ways of accessing some of our other information resources. And on the next slide, switch over to the right side, we put things here that if we have a new resource, a resource we want to highlight because of a current event, or we want to make sure that people see when they first come to our page. So we have the In the Spotlight. We also have links here to both our disaster lit database and to PubMed, and I'm going to go into a little more detail in a minute about both of these and what information you can get to from these. And we also have a place where you can see new documents that are relevant to this subject area in both Disaster Lit and in PubMed, and you can click on the More button and you would get the full search that we have scripted and entered into here. And further on down on the page, we have links to our CBRN and Hazmat products. And again, I'm going to go through these, but just to let you know, everything is accessible from this page. And finally, there are a number of ways to stay connected and stay informed. And I'm going to cover this more later, but I've highlighted a few of those areas here that are right on the home page. So this is what we would, I guess, call the actual toolbox in which our tools reside. You could get to them all from our home page, and you will be able to get to them as well from our newly designed page. So first, I'm going to talk a little bit about Disaster Lit. This is the resource that we use to organize the gray literature. And it's got a very simple search interface, which I've highlighted in that red box for purposes of this presentation. And by putting in a simple search terms or phrases, and I'll show you a little more about that, but you can get training courses and guidelines and reports and all kinds of other materials that are put out by hundreds of different sources that we monitor in multiple ways on a daily basis. So in this case, I put in a search for hurricane and flood, and it returned 67 records. And by putting the word "and" in there, as most searchers may know, you're only going to get records that have the word hurricane, and it has to have the word flood in there as well. This would be a more limited search than if I just put in hurricane or flood. Okay, while it's not as sophisticated as searching in PubMed, which is, has millions of citations in that and supported by a huge group, there are some important features that make it easier for you to use. And it currently uses an uppercase and or not to connect your words or phrases, for the Boolean searching. We may change that so it's more Google-like. It'll just default to and if you just put in a couple of words, or won't have to be capitalized, but for now the uppercase is required if you want to get results when you're combining words or phrases. So there's also filters along the left-hand side. So if you see, there's 67 records. And if you only want those from the American Public Health Association, you could click on that and you'll get, there's one record from the American Public Health Association. You'll see that. You can also filter it by a publication type. So if you're only interested in instructional or training materials, you could click on that and only get that publication type. You can also filter by year and also by author, but author is not widely used. Many of these documents are created by organizations rather than by individual authors, so that filter is not as relevant, but there is a presentation in there that I did, and so if you put my name in there, yeah, you would be able to filter and get my name, but more than likely it's a source or an organization. Now, I want to point out that we manually enter and create each one of these records. So we will look at the resource and decide if it's relevant to the scope of disaster lit, and we will enter that in and fill in the information on source, publication date, format, and we'll write annotations. And in the annotation, of course, we're going to try to put some of those keywords. So if you're looking for hurricane and flood. Now, in this case, this record on the first record on the page there does not have hurricane, but it has cyclone. So we do have synonyms, and we also have some stemming and plurals and other things. So you don't have to know the term. Like if you use typhoon, it will also show you everything for hurricanes and cyclones. So there is some of that. Let's see. Okay, this is just, I clicked on that first resource, and this is what you get. What we do is we link directly to that resource online. It has to be freely available on the web. We do not, at this point, download any of these records. They don't reside on our server. The links will go externally to the original source organization. And this is just another image of some of the things that you can get through Disaster Lit. There's quite a variety here. You're going to get some, web pages, some training materials, and a concept of operations and flow diagrams. And you can take a look here. There's quite a lot of variety on here, all of which is not published in the commercial journal literature, but as I mentioned before, is critically important to know about. And very hard to find. I will point out that, again, that we view hundreds of sources every day through certain procedures that we have and look for the most relevant material. And we would be, by doing this database, we're saving you, the user, the time of having to sort through potentially 1 million or more Google search results. So we have a way of doing that for you. So the other top part of that pyramid, when I mentioned disaster health information, was PubMed, which almost everybody who works in the medical or medical related field has used or is familiar with, since it's one of the largest, if not the largest, biomedical literature database in the world. So I entered the same search here. So I put in hurricane and flood. Now, by nature of this product, of course, it's going to get a lot more results. In this case, it got 180 journal citations with the words or terms or the meaning of the terms, hurricanes and floods, in them. And there in this particular case, 180 is quite limited, but there may be searches that you would put in and you're going to get tens of thousands of results. If you put the same search in disaster lit, you'll get a much smaller number. We only have about I think 12 or 12,000 records, but all those records in disaster lit are handpicked related to disaster and public health emergencies. So in PubMed, that's not the case. So you will get everything that has these terms, whether it's related to disasters or not. Our goal is to find a way that you can just do one search, and it will search both PubMed and disaster lit simultaneously. But we have not gotten to that point yet, but that is our goal. So when you search PubMed, most of you know too that it's not free. These are journal articles, and if you don't have a subscription somehow or access to a subscription to these journal articles, you're going to have to pay for them in some way, and it can get quite expensive. But a lot of the articles in PubMed are actually free in full text form. And on the left-hand side, you can see that I circled where you can click on free full text, and it will then limit it to those that are available in free full text. And in this case, quite a lot. There were 880 results, and 55 of them, that's a pretty big percentage actually, were free full text. And I guess while we're on the topic of free, the other thing that we do here at the National Library of Medicine is that a group in the library had entered into a partnership with the commercial publishers a few years ago, and this is called the Emergency Access Initiative. And when this is activated, when there's agreement between the publishers and NLM, the publishers then, if you go through this link, you can access either portions or entire collections for a temporary period of time. It's intended to be for those that are affected by the disasters, but there's no way that that's limited. So it was last activated, I think, as it shows here, not since 2014 when the Ebola outbreak, but this concept of information humanitarianism has caught on. During the Zika outbreak, many publishers actually took it upon themselves to open their collections or portions of their collections related to Zika virus to open access, so anybody can access those for free. And on a page that we have collected on Zika virus, we have collected all those links to all those different collections. Okay, so now moving back to predominantly gray literature, another way you can access information that's freely available on the web or through our collections of topic pages. And these are about either some all-hazard topics, just some hazards themselves, which would be, for example, hurricanes and typhoons or floods, as I'm showing here, or specific events like the Ebola outbreak, or on topics such as coping with disasters, violence, and traumatic events. And we collect as many relevant resources as we can that are freely available on the web, and we organize them in a way we think might be useful to users. But again, our new web design will be changing the way we do this. We're going to be focusing a lot more on providing links on these topic areas to disaster lit and to PubMed, and simplify the pages a bit, and hopefully all the information will be there and it will be more current because we don't have to monitor links anymore. They will automatically update. So here's an example of a topic page. This one was probably the last one that we did. It was last year on the Zika virus. This page is just hugely comprehensive. It's got information resources we collected ranging from guidelines on Zika virus to maps, to virus variation information, to social media tags, multi-language resources, clinical trials, situation reports, plus links to the journal literature and disaster lit. We there was quite a lot of information that was coming out on a daily basis, especially in the beginning of this event last year, and it continues to flow. And we update that as much as we can. So another area, we have a couple of pages dedicated to special populations and resources related to disasters. So we have a page about health resources on children in disasters and emergencies, and also one about pregnant women. And these are separate because their needs are very special and very specific. We worked closely with the U.S. Office of the Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services on putting this together. All right, now moving on our journey of through our resources, I mentioned earlier that you can access our CBRNE/Hazmat tools from our homepage, and these consist of WISER, CHEMM, and REM. I'm going to spend just a minute on each one. WISER, which is the Wireless Information System for Emergency Responders. This has over 400 chemicals and other radiological and biological agents. You can use this tool to either identify an unknown chemical through entering signs and symptoms, or you can get medical and treatment information and response information on a known chemical. So the pictures that I'm showing here is where you can actually click on certain properties and symptoms, etc., on different parts of the human body and enter what you know as a responder, and it will narrow down the chemicals from the 438 down to maybe a grouping of chemicals, and treatment can begin or evacuation procedures can be implemented. And for those that have been affected or could be affected. CHEMM, which is the Chemical Hazards Emergency Medical Management, is also about chemicals, and that can be a little confusing, but this is actually a tool for mass casualty events. WISER, on the other hand, is used for a lot of hazmat, smaller events. Where you may have a little bit more time to deal with what's happening. For CHEMM, when you have to implement procedures to treat and take care of patients on a much broader scale and must do it more quickly and time is of the essence, this takes you through a algorithm, or it's called ChemIST. It's an intelligent syndromes tool, and it gets you down much quicker to a grouping that allows you to identify what treatment may need to be initiated. WISER is available as a mobile app on the computer, on the web. I mean, you can download it to the computer. CHEMM is available to download to your computer, but it is part of the WISER mobile app. So it's integrated in there, so you don't have to know whether this is information related to mass casualty or to a hazmat event. It's all integrated. So REM, which is the Radiation Emergency Medical Management, is all about radiological nuclear incidents. This is a lot more text-heavy of a website, although there are a lot of tools that are available on here, and a lot of this has been used more so for training and preparedness as opposed to response activities, because fortunately we have not had an incident in the U.S. where we have needed this. A portion of this was translated into Japanese during the Fukushima event, but we have not used it here for an event that I'm aware of. The text, though, is supplemented by a lot of images, animations, and algorithms and such. So moving along, most everyone knows what a go bag is. So typical items you'd find in a go bag might be food and some medical supplies for yourself or the people you might be running into, flashlight, safety items, a couple tools, maybe a navigation device, things like that. But there's something that's even more critical, or as critical, I should say, as some of these items right here. And it's kind of, most of it's really missing. And so that's information. So what about information? Like, why do you need it? Well, I think that's probably pretty obvious that you need information before, during, and after for decision making, situational awareness, and information response. And the kinds of information you might need are listed here: evidence-based public health information, maybe news, social media reports for situation awareness, and some reference tools. But you can't possibly carry all this stuff with you if you're deploying or you're working in a response or even a planning situation. Just having all this is just not practical. So that's why we suggest you create your own digital go bag. And by this we mean segment a portion of your mobile device in a folder or a page and add apps to it, and apps that are relevant to disaster and emergency response and safety. So you can put a huge volume of information right there in your own pocket. And in cases where you don't have the internet, some of these apps, can be a lot more reliable than in providing you with information. So to help people get to the point of making a digital go bag, we have a page on disaster apps. We have reviewed many sites and many apps and compiled what we believe to be pretty highly useful ones. We put them on one of our web pages. You can access it from the web, tablet, or smartphone, so you can download the apps right to your mobile device. Just like our web pages, we use pretty strict selection criteria. We certainly don't have lots of apps on here that are developed by third parties. We can't rely on them to be updated, and we're never quite sure what the source might be. So there's lots and lots of other apps than what we show that are useful. But we select those, again, that come from credible sources or paid for by a credible source, and current content, no point of view, and free. And there might be an exception or two to the free, but it has to meet the other criteria. So just a couple of quick points about the apps. If you're using these in an emergency or urgent type situation, you should really learn about your app before you really need it, because they're not all created equal. Some apps are totally dependent on the internet, and others portions of the information. So our own apps for Wiser and REM, some information links out and requires the internet, but large portions of that are actually what you would consider a native app, which is the information is downloaded to your device, and you can use it and be internet independent. So also, it's important because I know, for example, that I'm always running out of space on my mobile device, and I have to be careful about which apps I add and how that's going to affect my battery life and everything else. So you really want to be careful that if you're, let's say, in a situation and you go to take a photo and you find out that all the space is used up because you've got too many apps or too many of something else. So you just want to kind of monitor that and sort of be prepared, that you're aware of what you have on your phone and how much space it takes up, and if you can handle that. So I said earlier that we focus in our NLM disaster health area on professional resources, but that we didn't ignore necessarily at NLM the consumer resources. So MedlinePlus, which is a big product of NLM's, focuses on the general public. So within MedlinePlus, there's maybe about 17 or more topics pages that have lots of links to information that would be useful and very relevant to the general public, their families, and their communities. So this is not necessarily to be ignored. It's just not something that my division works on. And in that same line, there's a product called HealthReach, which again focuses more on a consumer level. And this is designed to help those who work with and work among multicultural and multi-language communities. So there's not a lot of resources in here relevant to the disaster area, but it's very useful to know about this for these population groups. So if all this sounds interesting to you and you want to be more involved in supporting the information needs of your organization, your agency, community, population group, whatever, you can become a disaster information specialist. And we have a program here at the NLM Disaster Health to help somebody become a specialist. And it started as a pilot for librarians, but it's open to everyone. It's not for librarians necessarily. There are training courses available to help you become a information specialist, or you can just take any course that we offer. They're all free, they're all online. You can access them at this site here. And you can take a course, for example, on CBRN, more detail on CBRN, and learn more about what that is and how to access information resources. Or you can learn about how to get a seat at the table. You can learn about some of the stuff I talked about today. Where are the basic information resources? So we also, this program, I should say, the Disaster Information Specialist Program, it led to some very interesting collaborations between libraries and information specialists and the disaster-related organizations. And some of the things they did, they supported the Incident Command Center at a hospital, for example. They developed FAQs, they monitored social media, they developed apps, they developed web pages, they conducted training. There's all kinds of interesting things that they did to work in the disaster workforce. But short of that, you don't need to become a disaster information specialist to stay connected and stay informed about these resources. We help you with that. As I showed you on the web page earlier, from our homepage, there are a number of different places. You can actually just monitor our homepage for changes or information within these areas I'm showing here, or you can actually stay connected by joining an email discussion, an interactive discussion list. We have strictly an email push. We have RSS feeds, and we have a Twitter account, and you can see on our homepage on the bottom right-hand side, we show a few of those tweets, and that you can look at all of them there and follow us. And we also have those new documents from DisasterLit and from PubMed. We also have webinars ourselves about, well, every other month we've gone to now, and our next one's actually on March 9th on big data and data science. What do we need to know? In this, given by a librarian at the National Institutes of Health. And we also link to all the recordings and the slides from previous meetings. There's a link right there. So if there's a topic you think might be interesting, you might be able to find and look at the webinar about it. And we also post all the slides. You can feel free to use any of those slides at any time for anything that you're doing as well. So one last area on staying up to date, we also have a way of having you take the content from specific topic pages that we have. You can embed that through syndication on your own page, and when we update something, it updates on your own page. We don't have all of our pages done this way at this point, but we'll be doing more and more of them. And that's it. I just want to, thank you for having me and open this up. If anybody has a comment, a question, a suggestion, anything. So Andrew, I'll pass it back to you.
Thank you very much, Elizabeth. That was very informative. So if anyone wants to send a question, you can use the question feature, or I believe you could also send it by chat. I do have two here. I think this first one was already answered in this presentation, but I'll repeat it anyway. It was asking if this information is accessible for low and middle income resource countries.
Yes, it is. Everything that we have on our website, everything that's in the DisasterLit database is available. Now, only, the PubMed, I know there are arrangements that certain countries of certain, levels have access to things through some other organizations. But everything that we point to and we put into our disaster lit database is freely available to anybody.
Okay, and another question that came through during the presentation is asking if disaster lit is strictly gray literature, or does it include peer-reviewed published articles as well?
No, it does not, because we don't want to repeat it. Well, let me start over. It includes everything except what is in PubMed. We don't put peer-reviewed research or biomedical articles from PubMed because PubMed does that. And what we would like to do is create some kind of search interface that allows you to put a search in one time. You don't have to go to both, and it will search both disaster lit and PubMed and present the results, maybe even in a relevancy ranked order. But we just haven't been able to dedicate the resources to making something like that happen yet. But that would be our goal. But right now you would have to do both. You would go to PubMed to look for the journal articles, and if those are free, then you can click on that filter. And you would go to disaster lit separately.
Okay, I have a couple people here who have questions, and I want to give a opportunity for people to ask them, and I'm going to try, so everyone bear with me with the technology, but I'm going to unmute Rowena Christensen here and let her go ahead and ask her question and see if we can get a dialogue started. So, are you there, Rowena?
Yes, can you hear me?
Yes, we hear you loud and clear.
Thank you very much for a very informative webinar. I really enjoyed it. My question is whether there's an online training course that you have that will help people to use PubMed properly and to do effective searching. Thank you.
Yes, there are all kinds of online training courses on PubMed, and I don't work in that particular area. All I could do is point you to, and I'm going to actually, let's see if I can end the slideshow, and maybe I can go to a browser and tell me if is the browser showing up?
Yep, your browser.
Okay, so you would go to pubmed.gov, and and I don't know if you can see where I am pointing, but it says PubMed tutorials. There's also a quick start guide, but there's a whole section here on using PubMed, and there are free training tutorials, quick, and you can see a lot of these are very specific topics on how to search for things, and they run anywhere from 1 to 3 minutes, so you're not burdened by having to listen to a 10 or 20 minute or an hour-long presentation to find out what it is that you want to know. They've broken it up into very little segments, so that if you want to know just how to save your search results, or if you want to know how to use, I'm pointing here to the filter sidebar, and that should work for you. They also have, that's on searching, they also have some tutorials, broader level tutorials about how does PubMed work. But if you're looking to search in PubMed, you can see that there's this list right here. And those are freely available anywhere.
Okay, I have another participant, Robert Harley, who has his hand up here for a question. I'm going to go ahead and unmute Robert. If you're ready, Robert, you can go ahead and ask your question.
Hi, Elizabeth. Thanks a lot for your talk. I was just wondering if you're going to have your PowerPoint up and available afterwards so we could take our time copying down some of those sites.
Yeah, absolutely. Is the best way to do that, Andrew? Do you have a site that you post it, or what do you do, Andrew, typically?
Yeah, so we will upload a recording of today's webinar to the WADM website on the webinar page, and then if Elizabeth, which it sounds like she will do, will provide slides, we'll have those available right underneath the embedded video.
Yes. Yep. I'll do that as soon as we're done.
Excellent.
All ready to
Thank
go.
you.
Okay, I have another question from Donald, who incidentally is going to be giving the next webinar, which is next Wednesday. It'll start a little bit earlier than today's webinar at 2:30 Eastern Time, and he'll be talking about ethics. If you're there, Donald, I'm going to unmute your microphone, and you can go ahead and ask a question.
Hello, thanks very much, Elizabeth, for a very interesting presentation. I was just wondering how you select the new sources of information, and if we were aware of a resource that wasn't in Disaster Lit, is there a way to submit it to you for consideration to be included?
Yes, I'm going to go back. I'm going to go right to the web to Disaster Lit. Let's see, it should, well, if I, there we are. Okay, so yeah, if I'm trying to look here to see, okay, we have a link here actually called Disaster Lit, about Disaster Lit. So if you actually go to disasterlit.nlm.nih.gov and click on the About Disaster Lit tab, you can see a lot more information, more than I could probably just answer, about what's in it, what we put in it, how we select things. And in regards to the things that we select, I'm going to click on another link in here, and it's going to take you to sources that we scan for Disaster Lit. Now, this isn't necessarily every source that we scan. There are we have them in 3 levels of priority. There's priority 1. Those are sources that will put out on a fairly regular basis information that's relevant to our audience. And then priority 2 is they sometimes do. Priority 3 might be those one-offs that every now and then, you know, they might put something out that's relevant. I'm not sure if which level this goes to. I don't think it goes to all 3 priority levels. And then what we do is to make sure that we know what's coming out in this particular field from these different organizations, we subscribe to listservs, RSS feeds, and then we have a way of consolidating that in one place so you don't have to go to every one of these sites. And we also get a lot of information now off of social media. We have a very active Twitter feed, and we monitor through Hootsuite, you know, dozens of places, because that's where people are putting their information. So in order to be considered a source, and I'll get back and see if we talk a little bit about that here. Let's see. I want to see if we give a lot of organizations here. But what we do is we have to make sure that, first of all, it's, as I mentioned, just like any information that we would put within Disaster Lit, a source would be scrutinized the same way. It has to be from a credible and authoritative source, and meaning that, again, it doesn't have a point of view. I mean, there are .coms. It's not like you can't be a .com, but it can't be a place that, you know, publishes for you know, a certain viewpoint, or an organization selling disaster equipment, things like that. We wouldn't link to those as sources. So it might be a association, a government organization, an NGO, a research group. It can be any number of things. Again, we have, and when I showed you here, you can sort of see what some of the selection is, lots of associations and organizations. Does that answer the question? Oh, I know, you wanted to
Yes.
know how you can suggest something. And,
Yes.
you know, good point here. I'm trying to remember if on Disaster Lit we actually have a link to that. If not, I'm going to tell you how to do that. I'm going to see here, contact us. Let me see if this goes to the place I'm hoping it goes to. Yes, if you click on the contact us box or a little link up there, it's going to pull up in your email, however you have that set up, and it will direct you to an email address, dimrc at nlm.nih.gov, and I monitor that. So we get suggestions through this way.
Great, thank you very much.
All right, you're welcome.
Okay, I think we have couple more questions here. I know the next person did submit one that we already answered, Ola Dunn-Bell, but if you have another question, I'll go ahead and unmute your microphone and you can ask Elizabeth. Are you there, Ola?
Yeah, thanks very much. And thank you, Elizabeth. That was an excellent introduction. I was wondering, however, if we needed further information, if we were doing research on a specific topic, is there a contact person that we can get help with that?
Well, actually, sometimes if you click on Contact Us and send it to the email address that I just showed, there may be times, it depends on what it is. I can't say yes or no on that. It really depends on what it is, because we're not necessarily reference librarians, but if people ask us questions, we will often refer them to resources or a way to do something that will help them. So we're not probably capable of doing a lot with PubMed, but through navigating the gray literature, we're much better at that in our division.
Oh, and that's exactly what that helps very much. Yes, thank you.
Yeah, so send an email.